people don't usually have the idea what is scripted mean. Okay, I have discussed with a lot of students. They think if you are telling the script of Aspire notes or maybe from the NHS site, which they don't think usually, any other notes, if you are just repeating the words, the examiner will know that you are scripted. To be honest, any examiner who is sitting there and listening to the same station 80 times a day, the very first word you open, he can clearly tell you which academy you have prepared the stations. Okay, because how many scripts are there? 6, 7, and he is listening to the station 80 times a day. But obviously, based on those things, he cannot mark you scripted. Scripted is when you remember the station and you bypass a pillar question, a pillar investigation, and you still come up with a diagnosis. Suppose if it is a pneumonia, for pneumonia we know the patient should have chest pain, fever, shortness of breath, cough, productive cough, and rest of the things, they don't matter. And then moving on to bloods, including infection marker, CRP, and chest X-ray. These are pillar questions. Okay, and in chest X-ray we can see consolidation, and now we can give a diagnosis, confirmed diagnosis of community acquired pneumonia. This is the same thing for everyone, no matter which book you go through, which site you go through. Pneumonia is this, no matter how you explain it. The examiner cannot mark you scripted unless we bypass a pillar thing. What happened? We are going through pneumonia. From those symptoms, we know it is pneumonia. Okay, there is no weight loss, and there is productive cough, chest pain, CRP is high. Somehow we missed saying chest X-ray. We didn't do a chest X-ray investigation, and we are still giving a confirmed diagnosis of pneumonia. Now he is marking a scripted. Suppose for hyperthyroidism, from history everyone knows, sweating in the hand, irregular periods, and then all those things, weight lost despite increased appetite, change in voice, becoming thinner. So from these history things, we can clearly say it is hyperthyroidism. Before giving a confirmatory, before taking a confirmatory test, we are giving a diagnosis of hyperthyroidism. Now they are marking a scripted. So I believe now everyone got the point how they can mark a scripted. Don't worry about the script. Say it as it is. They cannot mark you scripted. It is the same medical knowledge all over the world. Okay. So for hyperthyroidism, if you are not doing a TSH and you are still giving a confirmatory diagnosis of hyperthyroidism, now he can mark you that you remember from the script with those symptoms it is hyperthyroidism.